Some 3 million Americans stutter, and as the Oscar-nominated film The King's Speech shows, it affects kings and commoners alike. So for this week's Please Explain, we thought that we'd find out more about stuttering, what it is, what causes it, how it's treated. And joining us are Dr. Barry Guitar, professor of communication sciences and disorders, and a professor of psychology at the University of Vermont, and Chamonix Sikora, speech therapist and executive director of the American Institute for Stuttering. Welcome to our show.
Thank you.
Hi there. Thanks for having us on.
Barry, can you explain what stuttering is, and are stuttering and stammering synonymous?
Yes. Stuttering is, I would say, like blockages or stoppages of speech at a relatively high frequency and severity. So they can be repetitions of sounds and prolongations of sound and complete blocks. And so I'm a person who stutters, and if you listen closely, I'm sure you'll hear it in my speech. Stammering, on the other hand, is not really a term used in the United States. It essentially means the same thing as stuttering when used in Britain.
Are there different kinds of stutters?
Well,
go ahead.
I think in Britain, the word stammering is probably used more for the tight sort of blocks that you saw in King's Speech, where Bertie was like really locking up. And in Britain, a stutter might be more like this.
Chamonix, does stuttering happen in all languages and in all cultures?
It does. It affects people who speak any language. It doesn't discriminate according to race, language spoken, intelligence. So we see it across the board and around the world.
And if someone is bilingual, will he tend to stutter in both languages?
Yes, a lot of clients that I work with here in New York, of course, are bilingual and multilingual, and they can stutter to different degrees depending on, which language it is for them. But typically, they stutter to some degree in all languages that they speak. Are
there certain sounds or words that are more difficult than others? John Stossel says that he learned to avoid certain combinations of sounds.
There's nothing physiologically about a specific sound that's going to make it more difficult to get out. Oftentimes, it's the experience that one has with those sounds, and they block on it or stutter on it one time, and then the brain remembers that experience, so they anticipate stuttering on it again, becomes a learned behavior.
Why don't people... Go ahead, Barry.
I think what Chamonix said is something that I experience all the time because my name Barry begins with a B. I had a lot of times when I had to say my name and I couldn't substitute something else. And I just learned that, to me it's a hard sound.
So you are prepared when you have to say it?
Well, now that I've had some therapy, I sort of get ready to sort of ease through the word like Barry.
Mm-hmm. Well, I didn't notice you stuttering on Barry. But why don't most stutterers stutter when they sing?
That's a good question. People have been trying to answer for a long time. I think one part of the answer might be that a different part of the brain is used for singing. That is the right hemisphere, which seems to be fairly intact in those of us who stutter. And so you're really calling on the right hemisphere for a lot of the production of singing.
Well, you said that you have developed some strategies. Didn't Marilyn Monroe whisper as a way of overcoming her stutter?
Exactly, yeah. In other words, one of the things that you don't want to do as a stutterer is have a real hard start to a word. So if you have a breathy start to a word like this, it keeps you from stuttering. And so it really worked for her.
Well, it sounds sexy when you look like Marilyn Monroe. Chamonix, do children start speaking without a stutter and then develop one, or does this begin with the onset of speech?
It varies from child to child. Some children do begin to stutter really when they start putting word combinations together and speaking in sentences. Other children, it takes a little while. It typically begins between the ages of about 2 and 4. A lot of children start around 3 years of age. So it does start early for developmental stuttering.
And can they outgrow it?
A lot of those children do outgrow it. The majority of the children that begin to stutter do kind of recover and outgrow stuttering on their own, even without treatment. It's our job as speech therapists that specialize in stuttering to look at what risk factors each child has to identify which children may not outgrow it, because the effects of allowing it to go on untreated there can be a lot of devastating effects as stuttering continues and has a psychological effect on a person.
Does it affect one sex more than another, Barry?
I think it starts in about equal proportions of both sexes, but girls just have this amazing capacity to outgrow it. I think because women's brains are a little more suited to speaking, and they have lots of sort of backup areas, whereas we men just have a little tiny area in the left hemisphere, and if that is damaged in any way, then we're in trouble. I just wanted to emphasize what Chamonix says, which is that if we can identify those kids early on, we can basically take the stuttering away. It's just that if we don't get it before the kid gets into school, then it's a harder problem to deal with.
Is that what happened with you?
Yeah, I mean, I'm of an age when there really wasn't much good speech therapy when I was, growing up, and I never got any decent therapy until I was in my 20s.
And so by that time, all of the patterns had been established.
Yeah, I mean, I'll never be cured, but by that time I was able to get some speech therapy to really make a difference in my life.
Chamonix, do we know what causes it? Are they physiological or psychological or both?
That's an important question. So a lot of people in the past have thought that nervousness causes stuttering, that there's a psychological origin to it, but we know now that it's really neurologically based. So the brain is involved here, and there's some type of mistiming or missending of messages. We don't know exactly what in the brain is causing it. There's been a lot of neurological studies, neuroimaging studies, showing us that parts of the brain in those who stutter light up differently than those who don't, as well as structural differences.
But doesn't nervousness play a role in this, Barry? It's been my experience that when I've seen people get nervous talking to a stutterer, the stutterer actually winds up stuttering more than he or she might have otherwise.
Yeah, and I really think that this comes out in King's speech. When you see Bertie is sort of put upon by his father and other things kind of make him feel less than confident, his stuttering comes out more. When Lionel Logue works with him and helps him develop his confidence, then his stuttering goes down. So I think the nervousness is a part of it. I don't know if I'd call it nervousness, but I think there are certain situations that we all feel a bit more intimidated by, like having to speak really quickly if you're at a busy delicatessen and shouting your order. And so those are going to cause a little more trouble for stuttering. But as Chamonix says, it's definitely a neurological condition at the base, not just from nervousness.
Although I wonder if there's a vicious cycle here because you feel because you're stuttering and people are responding, it just makes the situation worse. It exacerbates it.
Exactly.
Yeah, I think that's very true. I don't know if you remember the scene in the King's speech when he's about to give this talk as the Duke of York at Wembley Stadium, and you see a shot of the audience, and they're really uncomfortable as he starts to stutter. And as a child or adolescent who is stuttering, when I'd see that in an audience, it's exactly as you say. It makes you more nervous.
Well, you keep on citing that film, and for good reason. Most of my audience, I'm sure, has seen it, and I am. But do you think it was an accurate portrayal of stuttering?
Yes. Go ahead, Barry.
Go ahead, Chamonix. Well, as a person who stutters, I thought it was brilliant. I just thought they captured the feelings that a person who stutters has, that just huge anxiety that you're going to get really blocked up, and a feeling like you don't even know if and when the word's ever going to come out. And I think they captured also the sense of confidence that he got from his speech therapist, the sense that, I'm just going to go ahead and let it out, and, I can do certain things and they're going to work for me, and the heck with it, I'm just going to go ahead and speak when I need to speak.
Well, I remember when a fish called Wanda came out and stutterers were furious. I guess this film has gotten a different response from the stuttering world. We're talking about stuttering on Please Explain today with Dr. Barry Guitar, professor of communication sciences and disorders and professor of psychology at the University of Vermont, and with Chamonix Sikora, speech therapist and executive director of the American Institute for Stuttering. And if you have any questions about stuttering, you can give us a call at 646-829-3985, or you can also leave a comment on our show page at WNYC.org. This is WNYC and WNYC.org in New York. I'm Leonard Lopate. Chamonix, does stuttering affect the ability to acquire language or to read?
No, not specifically of learning to read or acquiring language, but there are studies that have shown some advanced language skills actually in children that stutter. So it does play a factor. So the language abilities, the motor skills that a child has, the environment that they're in, and also their genetics. So there's a genetic predisposition that can cause stuttering for a percentage of people.
But there's no link to things like dyslexia or other conditions that may cause problems learning how to read.
No, not specifically. There's you can always have a another separate disorder.
Barry, stuttering does seem to vary within an individual. Sometimes people have a hard time getting even one word out, and other times they speak quite fluently. Do we have any idea why? Is there some kind of chemical thing that's happening?
Well, certainly, it's what you said before, which is that, if you feel under pressure, you feel anxious, you really don't want to stutter, all those things make you stutter more. And so, I also think things like fatigue or being sick or other things like that will make your stuttering go up and down. And it's really vivid in children. When a parent first notices the child stuttering, maybe it'll be there for a couple of days, then it'll disappear, then it'll come back, and it's very hard for the parent to know whether to seek therapy or not. And I think in kids, it's so variable because it's influenced by language learning, it's influenced by how excited the kid is, how tired, and other things like that. So yeah, the variability is really affected by so many different things.
And I'm sure that when a child starts stuttering a little bit, and a parent thinks, should I seek treatment? The parents are usually reassured, it's okay, it'll just go away. Pediatricians often say that when any number of conditions occur, and often they do go away, but sometimes they don't. So how do you know when to seek treatment, Chamonix?
If a parent is concerned at all, I would encourage them to seek out working with a therapist that specializes in the treatment of stuttering. There are different types of speech therapists, actually, generalists, and we now have ones that target and work with children that stutter. So if they're concerned at all, I would say to seek someone out to get an evaluation. There's different ways that we can intervene. You can intervene early and work with the parents of a child. Even when you begin to just educate them about stuttering, you're starting to intervene. They're starting to learn what's normal, what are things to look for, what to be concerned for and not.
Well, with many neurological conditions, early intervention is a key.
Yes.
Because the brain is still forming. Is that what's happening here?
Yeah. Absolutely. The earlier you can intervene in order to get the neural pathways really set down and ingrained for fluent speech, that's really the goal of working with young children who stutter, of really preventing the stuttering from growing and allowing the neurology to develop for fluent speech.
Barry, as you said, you didn't have that when you were a kid. I'm assuming that it must have been really tough on you when you stuttered and kids made fun of you.
Yeah, I grew up in a small school in Connecticut, and so luckily in that sort of situation, I didn't have a lot of severe teasing, but the internal frustration was tremendous because I'd get really hung up on a word and it wouldn't come out. Or if I was called on in class, I'd just say, I don't know, even if I did know. And so those sorts of things just give you this feeling of not being a good speaker. Maybe you think people don't want to hear you, your teachers maybe don't want to call on you. So there are a number of things that all of us who stutter have gone through. And what Bertie in King's Speech went through sounds like it was quite bad in the sense that his father being quite a tyrant.
Well, also, it lasted so long before he sought any treatment for all sorts of reasons. I'm assuming adult treatment for stuttering is different than what they do with kids. Do you do any singing exercises?
We actually don't. Now, Chamonix, I don't know if you do, but
no.
The closest we would come to it is that for part of our treatment, we teach people a way to speak, and let me just sort of demonstrate it. It's when we do it here, we call it super fluency, and so it's a slightly slowed rate. It has a little kind of gentler sound to it, and it's a way of talking that's not singing, and it doesn't sound too different from normal speech, but it's often an effective way to give yourself a lot of fluency.
Chamonix, there's a scene in the King's Speech where Lionel Logue asks Prince Albert to read something while he's listening to music. Can you explain why that might work to stop stuttering? Or was that just, did Lionel Logue have really good ideas, or was he just trying pretty much everything?
Maybe a little bit of both there. So the idea of listening to music more has like a masking effect on it. So within the brain, in a sense, it masks and it produces a fluency effect. So there's numerous things that you can do to get that type of effect. It's not lasting after the music is off. Interestingly, there are other maybe less therapy, speech therapy approaches, but organizations like Our Time where the kids do learn to sing and act on stage as a way of building their confidence, and that can be an important piece for a child too.
Well, Mel Tillis wound up developing a whole career on the fact that he stuttered terribly when he talked, but he never sang with a stutter.
Yes, and Carly Simon as well. There's numerous.
Is there a genetic component? You seem to suggest that.
Yes.
Does that mean that it runs in families?
It does tend to run in families. Just this past February of last year, a study came out in the New England Journal of Medicine that did show us and identify at last 3 genes that are responsible for causing stutter in about 9% of people who stutter. So we are seeing that, and that could help lead to discover more genes.
Is it possible to treat stuttering with drugs, Barry? Like anti-anxiety medications?
Well, exactly. There is a drug called Pegaclone that was developed by a drug company just for reducing social anxiety. And in some of the field trials, they've discovered, lo and behold, those people who stuttered really reduced the amount of stuttering they have. So there's not a drug that'll take it away, but there is a drug that, when used with adults, will really reduce it.
We invite our listeners to write in, leave a comment on our show page at WNYC.org, or you can call us at 646-829-3985 to talk with my guests on today's Please Explain Look at Stuttering. Dr. Barry Guitar, spelt the way you'd imagine. That's musical, Barry. Professor of Communication Sciences and Disorders and Professor of Psychology at the University of Vermont. And Chamonix Sikora, who's a speech therapist and the executive director of the American Institute for Stuttering. We'll be right back. And we'll be taking your calls at 646-829-3985 in just a moment. You can leave a comment on our show page at WNYC.org. For today's Please Explain Look at Stuttering with Chamonix Sikora, a speech therapist and executive director of the American Institute for Stuttering, and Dr. Barry Guitar, professor of Communication Sciences and Disorders and professor of psychology at the University of Vermont. And Harry left a comment on our show page. He said, after a bad bicycling accident and several surgeries requiring general anesthesia, I found myself stuttering for almost a year afterward. Does trauma or anesthesia affect the speech part of the brain? You're
Yes.
not nodding your head, Chamonix. Radio.
It can. So it sounds like if there was no previous stuttering going on for this person, that's a case of neurogenic stuttering. So what we've been talking about here has been developmental stuttering, when a child begins to stutter early on. And after a trauma, brain injury, developing something like Parkinson's, those are things that can bring on stuttering.
What about psychological trauma, Barry?
Mm-hmm.
I think that can have an effect. I mean, for a young person, who's predisposed to stuttering through genes, as Chamonix was referring to have a sort of a sudden fright or a lot of stress, that can be the trigger that sets it off. On the other hand, you can have an older person who goes through a lot of stressful time, and for reasons we don't really understand, stuttering can start. And often, if stuttering starts from those sort of psychological causes in adulthood, it's fairly treatable. And so using the traditional methods that we use, we can really help folks with that kind of problem.
You mean talk therapy?
Yeah. Mm-hmm.
Okay, let's go ahead.
Oh, what I meant by traditional therapy is regular speech therapy. Some psychotherapy might be a useful thing in addition, but for a psychological onset, regular speech therapy can be a big help.
Amy from Manhattan, you're on the air.
Hi. A long time ago, I was on a subway train, and I saw 3 people speaking in sign language. Mm-hmm. And one of them had this sort of consistent hesitation at the beginning of each time he spoke. And
wow,
after watching for a while, it occurred to me that he was stuttering. Mm-hmm. And I hadn't even thought about the possibility of stuttering in deaf people.
Stuttering in sign language. Because the brain still works the same, Barry?
Well, definitely sign language is generated by the same hemisphere that regular spoken speech is, that is the left hemisphere. And so it's quite possible if you get the same sort of genetic predisposition, you may end up with the same sort of thing, that is a repetitive or hesitant thing in the output of language.
Have you seen anything like that, Chamonix?
Well, interesting. There's something similar to that in music and with musicians starting to play their instrument with the orchestra and kind of hesitating and blocking as they go to play an instrument. That's just another interesting type of stuttering that they see out there. They've also seen it in certain types of birds before as they begin to chirp and getting a little stuck as they begin to chirp. So
birds can stutter?
They're in a sense, it's similar to stuttering. So interesting stuff.
We go now to Ned from Norwalk, Connecticut. Hi, Ned.
Leonard, how are you?
I'm okay.
So my question has been touched upon in both in 2 fashions here. My father stuttered, starting with the death of his mother when he was 8. I stuttered very badly to my early 20s. And my children don't stutter per se, but they mumble and elide their words as a barometer of their mental condition in such a way that it's very, very accurate for us to tell how they're feeling about things. And so my question is, to what extent is this hereditary? Your guest commented on there being 3 genes. Is there anything more you can comment about that?
Well, I just take a shot at it. I definitely think there's a lot of heredity going on in your family, Ned, in the sense that your father's stuttering might have been set off by something psychological, but indeed it was probably there all along, and then you got somewhat of the same genetic makeup, and that contributed to your stuttering, and congratulations to you for getting over it as well as you have. And then for your kids, I'm fascinated with your mentioning the sort of mumbling that they're doing, because I know as a kid my parents were always after me for mumbling, and I think, it's somehow related. It's one of those little quirks in the left hemisphere where under certain kinds of pressure you just don't come out with it as easily. And so, the answer is I think it's genetic. What do you think, Chamonix?
Absolutely. I would agree with you on the genetic piece. Another thought that goes through my mind regarding the mumbling reminds me of something in our field called cluttering, which people are much less familiar with, where words kind of jumble together and get cluttered, and it's very difficult to understand what a person's saying. So it's kind of an offshoot, separate diagnosis from stuttering.
Now, I'm curious, Ned, because you don't seem to be stuttering at all. How did you get past it?
When I was 21 or 22, I got a job that part of the job was I had to engage in some public speaking, which for those who stutter, they know I'd almost prefer to be put in front of a firing squad. And it was one of those life-changing moments when I realized I either had to get over it or it was going to materially affect the rest of my life, and I just basically bulldozed my way through it.
Well, congratulations. Thank you so much for calling us.
Okay, thank you.
And a reminder that our number here is 646-829-3985, or you can leave a comment on our show page at WNYC.org. We go now to Anthony in Yonkers. Hi, you're on the air.
I'm sorry. Hey, Leonard.
Hi, Anthony.
My question is this. I've been a lifelong stutterer, and I recently went to speech therapy probably 4 years ago before law school, and I noticed that throughout my childhood I went to speech therapy, and it was very different from then. But I understand that I was a child then and an adult now. But I was curious on how the methodology has changed, because my speech therapist also alluded to that fact when I was going through the therapy itself.
Well,
which one of you wants to begin? Okay, Barry, you start.
I'll start, and then we can have Chamonix talk also. I think that there are lots of ways in which we understand that much of stuttering in adults is based on fear and anticipation, and that nowadays we know enough to help a person not only find a way to talk that's sort of smooth and doesn't, bring the vocal folds together too hard, but also gets the person over the fear of the moment of stuttering by just going ahead and saying words that you might stutter on, by even doing some voluntary stuttering, so you realize that you can stutter and hold people up, and it's not going to cause the world to crash around you. And so I think just our understanding of human psychology and learning has really helped us be able to find more effective ways of not only getting the stuttering under control in the clinic, but helping the person generalize it outside for the long term. Chamonix, any?
Yeah, absolutely. I think there's been a lot of changes working with young children that stutter. We definitely intervene a lot earlier. There's different programs and ways of intervening for young children as young as 2 and 3 years old, working with their families now. In addition to what, Barry, you were saying is so key, the fact that we're not just working on physically how to get words out easier, but really tapping into how is this affecting a person's life, and how those fears of stuttering and the negative experiences a person has can really affect them psychologically and be detrimental to their life. They can go into careers that they have no interest in, use a different name for themselves when introducing themselves. It can really affect every aspect of a person's life, and we address those things much more, I think, now.
Mm-hmm.
Barry, did you ever consider not calling yourself Barry? Finding a name that would have been easier to pronounce?
Well, I did try to convince my parents to call me Roy Rogers when I was about 6 years old, but they didn't get into that, so I was sort of stuck with Barry.
Let's take another caller. Ed from Long Island, you're on the air.
Yes, hi, how are you, Leonard? Great shows. When I grew up, both my dad and my uncle were heavy-duty stutterers, and they also smoked quite a bit. And my grandmother, their mom, was a very domineering woman. Yet my siblings or my cousins show no sign of this at all. And the second part of my question is, do you find when people are in a social situation, drinking, having a drink or two, does the effect of stuttering change?
Well, I'll jump in on this one. I've heard from a lot of clients, and Barry, you can speak from your own experience. Many clients that with drinking, sometimes they'll stutter more, and then other times they'll stutter less. So it really varies from person to person. And then sometimes a little drinking reduces stuttering, and a lot of drinking can really put them over the edge. So how about you, Barry?
Well, I find personally if I have a drink or two, I do become much more fluent. And I wonder if that doesn't mean it's reducing the anxiety, and anxiety is an important component for me. But I have the same experience as you have, Chamonix. You know, a lot of people who stutter will tell me that they get worse when they stutter because they can't use the therapy techniques they were taught. And other people tell me, I get better when I stutter because I don't really worry about it. And some people say I get better with beer and worse with whiskey.
But you've got to be careful. I have actually worked with someone, too, who had to go through AA first before coming to speech therapy. So a lot of people do self-medicate.
Self-medication is a real issue here, obviously.
it's a struggle,
A listener wonders about when you laugh. Does stuttering affect that?
I haven't found it personally at all, not whatsoever.
Okay, let's go to Catherine from Northport, Long Island. Hi, Catherine. You have an odd question.
My question is, does stuttering have anything to do with intelligence, say in a toddler, 2, 3 years old? If they have higher understanding, they're eager to express themselves, and the words just don't come out easily.
Chamonix?
Well, I would, my answer to that is that that intelligence does not play a factor. We have children of, all different intelligences that do stutter. There have been some interesting studies, though, on language and higher language skills and related to stuttering. So we do look at how language could be affecting what's going on with the speech motor system. So some people think that there's a mismatch between high language skills and then a speech motor system that's a little underdeveloped, and that being a mismatch and could be contributing to stuttering.
Yeah, I think that really hits it on the head. I love to see little girls about 2.5 start to stutter if they have great language skills, because those little kiddos really recover quite easily. And so if if they come to us for treatment, it's usually a fairly brief thing. But I think it's just what Chamonix says. If it's kind of like the desire to put out language and the great vocabulary and syntax a kiddo might have just is overpowering his speech motor system.
A listener who hung up asked about whether breathing exercises will help.
I would say to that, in and of itself, that's not something inherently. Stuttering is not a breathing problem or disorder. So by itself, it's not something that's going to cure or totally fix stuttering. It is something that can get really thrown off during moments of stuttering. So to relearn normal diaphragmatic breathing can be very helpful. It can also, from a psychological perspective, ease the fight or flight response and keep a person more relaxed. But it is the baseline of relearning normal fluent speech, so the breath and then the vocal folds vibrating easily and gently and the articulators moving easily.
Another person who called earlier actually had a follow-up question. He wondered if people with Asperger's syndrome tend to stutter more.
I don't think they stutter more. I mean, we do sometimes see folks with Asperger's who stutter, but I don't think in any greater proportions. Chamonix, do you agree with that?
Right. I've worked with people who have Asperger's and stutter, but it doesn't seem to be increasing. There's not more people who stutter who have Asperger's that we know of, that I know of.
Let's go to Tom from Seabright, New Jersey. Hi, Tom. You're on the air.
Hi. Thanks for taking my call. You might have answered this question just recently, but I have a 5-year-old nephew, and he's an only child, and he seems to have pretty advanced language skills, but I'd say 10% of the time he'll get stuck on a word, stammering a phrase, or I don't know if stammer or stuttering is the right word. Is that normal or something to be concerned about? Like he'll have to repeat the word. It might not be that difficult of a word, but it might be at the end of the longer sentence, and it seems to get in a loop where he has to repeat it 3 or 4 times before he'll get it out. And I remember when he was a little younger, when he was first starting to talk, he was even aware that he was stuttering. He was stuttering more back then when he first learned to speak. And he seemed to be aware of it, too, because he'd apologize sometimes, which is kind of upsetting.
This leads me to ask if there's a spectrum, as there are in so many other neurological conditions, like autism.
Yes.
So some people might have it worse than others, and would this child be on that kind of spectrum, do you think?
There definitely is a spectrum of more moderate or mild stuttering onto more severe, and definitely, within neurologically, that's something they're looking into. Are there different gradients or degrees of stuttering? For this case, I would say to see if they haven't already gotten an evaluation, it's really important to seek out an evaluation with someone who specializes. Again, there are these speech therapists that specialize in the treatment of stuttering.
Aren't there also electronic devices that some people use to control stuttering?
There's something called Speech Easy, which we would only recommend for adults who know the sort of limitations of it. But the Speech Easy device makes you feel like you're talking in a group of people all saying the same thing or reading chorally or something like that. And so the people I know who use it as part of their speech therapy say that it only works for about a third of their clients, and it doesn't really work very well in a noisy environment. But if they know the limitations of the device and they need fluency in a certain situation, like on the phone or in meetings or something like that, they can make good use of it.
Now, we have no time left, but a good question is, if you're talking to a stutterer, any advice to someone? Just sit back and relax?
Yes,
just
listen.
be patient. Yeah, and show with your face that you're giving the person plenty of time and you're interested in what they are saying.
And don't complete their sentences for them.
Right.
Thank you both so much for being with us today. We've been talking about stuttering on today's Please Explain segment. Dr. Barry Guitar, Professor of Communication Sciences and Disorders and Professor of Psychology at the University of Vermont, and Chamonix Sikora, speech therapist and Executive Director of the American Institute for Stuttering. It's been a real pleasure talking with you.
Thank you.
It's been a pleasure for me, too. I've really enjoyed being on with Chamonix.
Yes. Nice being on with you, Barry.
On tomorrow's show, actually on Monday's show, Wendy Kopp, the founder and president of Teach for America, talks about her organization's efforts to end educational inequities. And then 8-time Grammy nominee Joan Osborne performs live in our studios. Also, Rana Dasgupta on his novel Solo about a 100-year-old blind Bulgarian man. WNYC reporter Kathleen Horan fills us in on Out From Behind the Apron, her event about bartenders in the green space, and Maxine Hong Kingsman reflects on her life and aging. The Leonard Lopez Show is produced by Blakeney Schick, Stephen Valentino, and Julia Corcoran. Melissa Egan is the executive producer, and we had help today from Kim Gittleson, Matt Gurry, and Andrew Katchen. Debbie Founder was at the audio controls. I'm Leonard Lopez, your host. Thanks for listening. Have a great weekend. We'll see you on Monday.